Despite the drop in the number of new HIV infections by 47% from 41,416 in 2019 to 22,154 cases in 2022, failure by expectant mothers to adhere to antenatal care could pose a challenge in reducing mother-to-child transmissions. Teen mothers are a major concern as they go to clinics at the last minute to give birth already having the virus. Mary Onjiku, a mentor mother in Machakos County, says that if mothers embrace these clinics, the number of children born with HIV will reduce.
Every woman akikuja kwa hospitali, if she's pregnant, anafaa kwanza kwenda kujua status zake, and after that maybe if you find a mother is HIV positive, now undergo the process ya counseling through the HTS counselors. Dr. Mutinda Mutuku from National Syndemic Disease Control Council says policy reforms need to be put in place to reduce cases of MTCT, which currently stands at 11.5%.
Is it just a percentage? Those are numbers. It means that out of every 100 children born, 11 of them were born with HIV. That was in 2017.
There's also a need to involve communities in ending the threat, as Patricia Asero Ochieng, Executive Director, Ringa Women Group in Homa Bay County, explains.
Nakumbuka tulisukuma mpaka tukasema that what you have is not correct. Hatuna starter pack. We need the starter pack so that you can say mko na program. And that is the time you had to have a CD4 of 250. Kabla hujaweka kwa nini? So we are able to reach our communities at every level. We need to have strong governance structures within our organizations. We need human resource. And we need funding so that we have better infrastructure to be able to carry out and to do our roles.
Counties have also been faulted for not being transparent in the allocation and utilization of funds for HIV response, with only 34 counties having fulfilled the mandate.
The question is, does our country have systems which warrant or which support our mothers and the girls to achieve the 4 required NCs? Then the next question is, because health is devolved, what should county governments do to ensure that we get 0 new infection among that population?
This year's World AIDS Day will be marked in Meru County on December 1st, with concerns of the day recording highest number of adolescent pregnancies, as NSDCC focuses on ending the triple threat.
Huge budget in the villages.
Douglas Bosire, Program Officer, County Support Division at NSDCC, says Meru County reported 36% of SGBV cases among children aged between 10 to 17 years.
We again noticed today that Meru County is leading in terms of adolescent pregnancies in the country, where 1 out of every 3 clients who access ANC services at the health facilities in Meru is a child aged between 10 and 19 years, and that is unacceptable. Meru County also has unacceptably high levels of sexual and gender-based violence, where of all the cases that are seen due to SGBV, about 36% are children between 10 and 17 years.
With this year's theme being Let Communities Lead, it is noted that communities should be funded to collect data and evidence for efficient programming, with Kenya committed towards ending HIV by 2027. For K24 TV, I am Electin Odera.